You're listening to Confessions of a Counselor podcast. Here we will talk all things mental wellness. Hi everyone, it's Janice here, and welcome back to Confessions of a Counselor. Today I wanted to talk about diagnosis. This is something that I talk about with my clients on a fairly regular basis. I do want to disclaim before we get started that as a registered social service worker who practices psychotherapy, it is not within my scope of practice to diagnose. However, this is a conversation that I have with my clients if they're looking to seek diagnosis or if they feel like they should. And so this is something that we can debrief and talk about to figure out if diagnosis is right for them. Coming from this perspective, it's really important to recognize what is a diagnosis and what does it mean to that person and how is it going to affect them. So over the years, diagnosis has meant many different things for me in my life, both personally and professionally. And so recognizing and realizing what this means is really, really important. So first of all, let's talk about the DSM. So this is the Diagnostic Manual that a professional who is able to diagnose would use to find and use to discover a diagnosis for someone. So this is a tool. And in terms of the work that we do together, I can use the diagnostic screening as ways to see if your behavior or your symptoms, if you will, fall into a certain category. Again, I am not diagnosing, I am not able to diagnose, but we can use this as a tool to see if you would even fall into a category. This can be a resource that helps you to understand your symptoms or your behaviors. And this is where it becomes a personal choice. So for some clients, being able to find that category and see the symptoms or behaviors in a list like that can be super helpful and help them to see and feel heard and understood in all that they're experiencing. And so this piece of diagnosis might really support them in understanding themselves and finding tools and skills in order to cope with what's going on in their lives. For someone else, this might feel like a limitation. It might feel like a label, like a stigma, and like somehow this is going to prevent them from doing the work that they need to do and to discover the skills and tools that are going to help them to live the best life possible. And so understanding that these are two ends of the spectrum and that you can land anywhere in between is what we can do together. This is a conversation that we can have to help understand and unpack what does diagnosis mean to you and what do you want to do about the symptoms and behaviors that you're having, and is diagnosis the right fit for you? I hope you enjoyed today's episode. Confessions of a Counselor podcast is available anywhere you like to listen to your podcast, both on Apple and Android. New episodes will be released every Friday. If you enjoyed this podcast, please feel free to join the conversation. Leave a review or subscribe to the podcast hosted on the Anchor app. All these details can be found at janicelyons.com. Until next time, take care.